back. It is Medical Monday night. If you are just joining us, I'm Carrie Sharp, joined by Dr. Leif Swanson, a dental surgeon. But tonight we're talking about sleep relief solutions. And if you suffer from sleep apnea or just think that you might, and you want to consider something besides that CPAP machine, there is an oral appliance that may do the trick for you and allow you to sleep better at night. And that sure sounds good, I'm sure, to a lot of people. Thank you for being here.
Thank you so much.
We've had some great callers already tonight. I do want to encourage you, if you have a question about sleep apnea and your options, now is the time to call. It's some free advice. You can't beat that. 615-737+ is the number to call. I think something that holds a lot of people back in any medical thing, they think, well, I'm doing okay, it may be too expensive, I don't know if insurance will cover it. Let's just get to the bottom of that. How much does it cost, and does insurance chip in?
Good question. So the interesting thing with this appliance is, you know, even though you're coming to a dental office, is that we are doing what I call cross-coding. So we are able to bill your medical insurance. And most of the medical insurance, as long as we have a sleep study, and if you already have a sleep study and it's been the past 3 years, it's current, then we can file it to your medical insurance. Also, a lot of the Medicare plans also provide coverage for it as well. And so some people that have the Medicare benefits and a secondary insurance, and so they're able to file to them to both.
That's fantastic if folks can get it covered. And also, it is the end of the year and people may have a few more dollars left in their FSA or HSA and think, now may be the time to do something about this problem I've been dealing with, right?
Correct.
Yeah.
Typically the appliances, and a lot of people ask what the cost is. It depends on the person and the severity of their sleep apnea, but it's ranging from anywhere between $3,000 to $3,800, and typically insurance pays for probably half of that.
And I think that you told me before you have a woman in your office who is really superb about billing these things and knowing who covers it and who doesn't. She knows the drill.
Absolutely. Heather, she is amazing, and she is a person that handles all the insurance, and she files it with the insurance. She does the predetermination to see how much they're going to cover, and which is a great service for the patient themselves.
Yeah, so they know this going in. There's no surprise at the end like, hey,
Correct.
You owe us a couple $1,000s.
Most of the time we have the patients pay up front, so they are able, once we file it, that they receive the check from their insurance company.
Very nice. Let's hop back to the lines. Rhonda is on the line. Rhonda, thank you for your call. What's your question?
My question is that thing they have on TV with that teeth guard, is that called an occlusal guard? And does an excessive teeth grinder, do they need one of those pieces?
Does that question make sense to you?
So I want to make sure I understand the question. Does this help with teeth grinding?
Is that what you're calling about, Rhonda?
Yes, sir. Yes, sir.
Rhonda, you can just listen to your phone and not the TV. Are you asking if this appliance that Dr. Swanson brought in helps with teeth grinding?
Yeah, if they have excessive teeth grinding.
Okay, I'm going to hang up so you can listen to your TV now, so we'll give you the answer there.
Good question, Rhonda. So the answer to the question is yes, and a lot of the times the teeth grinding is coming from that airway being obstructed. But not only that, is with the retainer covering the upper and lower teeth, it protects the teeth, so to speak. It's a hard acrylic that protects the teeth from causing those teeth to wear anymore.
Now, if she is just a teeth grinder, though, which I'm sure she could do a sleep apnea test, go to her dentist, talk to them, this may be a little excessive, right?
Correct. If she is just a teeth grinder, we do make what they call knot guards that protect the teeth from a person that just grinds at night. But typically there's a culprit, or there's a reason that they're actually doing that. I mean, there are some psychosomatic things where people do that, but a lot of times after we do a sleep study, you know, we're able to diagnose this is actually coming from, you know, it's a person that's having obstructive sleep apnea.
And as a dentist, and you see that teeth grinding, what are the other consequences of that long term?
Well, the interesting thing is once you lose that tooth structure, it's hard to regain it without doing some type of full mouth rehabilitation, you know, of restorations. So as that tooth structure goes away, that airway space becomes, you know, narrow and narrow. So it actually makes the process even worse.
I understand. Take me through the process. Somebody comes in and says, I think I have sleep apnea, not really sure. It starts with the test, right?
Correct. So we send you home with the take-home sleep study test. It takes about a few days to get the results back from that. Heather calls the patient themselves, goes over the results, and she handles all the insurance stuff for the office. And then after that, if the patient wants to schedule a consult, we can schedule a consult and go over and make sure they're eligible or they're able to do the appliance itself.
And so you do the fittings, right? How long does it take to actually make the mold and get the retainer back?
It takes about, in the office, to get the bot and to do the impressions, you're only looking at between 30 to 40 minutes. Once we send it to the lab, depending on, especially this time of the year, it gets kind of busy, so it may take a little bit longer, but usually a couple weeks. Okay.
And then they come back for a fitting and to find out how they use it, I imagine?
Correct. They come back for a fitting, and with included in the price, we also do 1 year another take-home study just to make sure that they're getting the results that they want. Typically, once people can wear the appliance, they know right off in a few days that they're feeling better.
And you said it usually takes about a week, 10 days, to actually kind of get used to it?
To kind of get used to it. I mean, some people are more adaptable than others, but I think on average it takes about a week to 10 days, and for somebody to kind of get used to going to bed with something like that in their mouth.
You said you've had to do some tweaks. What kind of tweaks do you do when they're necessary?
Sometimes the patient, the significant other spouse is saying, they're still kind of snoring a little bit. Is there anything we can do to adjust that? And actually, we have little titrating screws in the back where we can still advance it just a little bit more to make sure that they're getting the results that they want.
And all of this is in that package price?
Correct.
Makes a big deal. So everyone kind of knows what's going on from the start financially.
Absolutely.
Is this a lifetime appliance? Do you have to replace it?
Oh, that's a good question. So, depending on the person and how good they take care of the appliance, which that's a big part of it, they'll last anywhere between 5 and 7 years. Some longer, but on the average, 5 to 7 years is what we're seeing.
And how do you take care of it?
Well, once you take it out in the morning, we just have the person brush it. We have different solutions. We typically don't like to use a paste because that can be more abrasive to the appliance and the acrylic itself. But we have cleaning solution and stuff they can just brush or even put in like a cleaner. And once they come back home and they're ready to go back to bed again, they take it out of the cleaner, put it back in, and it's pretty simple.
And just go to bed.
Yeah.
Off you
Instead
go.
of the CPAPs where you're actually having to clean the hoses and all the air things that are in and out, I mean, that can be a maintenance nightmare sometimes.
How long has this been around?
Interesting question. So the company Somnomed that I've been using actually started in Australia, and they've been around about 10 to 15 years. And the interesting thing is that in a lot of countries, this is the standard of care versus the CPAP, because they have found more compliance with the appliance versus the CPAP machine.
That's interesting. So we're kind of behind the times a little bit on getting on board with this.
Well, sometimes.
Okay.
Yeah.
Interesting. Kids in this appliance, because we are seeing more and more children suffer from sleep apnea. Does this work for children?
Typically, we don't like to use this type of appliance for children because they're still undergoing craniofacial growth. I think that's a good question, but the interesting thing is what I'm doing is parents that have concerns for that, I'm sending them either to their pediatric dentist or an orthodontist, and they're able to make appliances that can either go up in the roof of the mouth and expand, where they need expansion in the palate, or make little devices orally that are fixated, because you typically, with a child, that's something they could choke on. So we like to stay away and just kind of keep it for adults.
Well, and I would imagine too, trying to have a child or even a young teen use a CPAP, compliance would be way down.
Exactly. And with an appliance in kids that are losing teeth and getting new teeth, it kind of makes it hard to pre-fit the appliance to their teeth.
Now, even for adults lose teeth, adults have dental issues, as you well know as a dental surgeon. What happens if you lose a tooth or something happens and you have this device?
Yeah, that's a great question. So what if a tooth breaks and they need a crown?
Yeah.
Well, most of the time you can come back in, especially in my office, because I'm obviously familiar with this appliance. We can actually make sure that that crown, after it's cemented, that it actually fits the appliance after we put it in. And most of the time it's just small adjustments inside the appliance itself, and
you're still good.
Still good.
Okay, let's hop back to the lines. We have Jim calling in. Jim, thanks for calling in. What's your question?
Hello?
Hi there. Go ahead with your question, Jim.
Yeah, I have sleep apnea, and I have dentures in the top and implants in the bottom where I take out at night. And I have sinuses and I have drainage, and I can't wear the CPAP machine.
So you're wondering if this would work for you?
Yes.
Okay, I'm going to hang up on you so you can just listen to your TV. Okay, Jim? Thank you for your call tonight. Great question. I hadn't thought about that.
Yeah, that's a great question, Jim, and I'm glad that you asked that, because there are a lot of people that have removable prosthesis, dental prosthesis that they wear, be it dentures or partials, and you can make appliances for that, and they're fit. We can actually even use your denture as an impression to use for the appliance itself, and instead of fitting the teeth, it's going to fit just like your denture would, and it would still move that bottom jaw forward to
So then you have to wear the dentures at night.
You would not have to wear the dentures at night. Instead of the appliance fitting the teeth, it would actually fit as a denture is. It'd be all one piece, like a denture.
I understand what you're saying.
And it would fit up in the roof of the mouth instead of the denture itself.
That's great, because obviously sleep apnea is usually seen in older people, not all the time, but at least middle age and up. So you're also talking about people losing teeth and
so that's a good question. Yeah, so we can absolutely fit to people's, and edentulous we call it, without teeth space.
Okay, Jim, great call. All right, we have to take another quick break. When we come back, more of your questions. If you want to call in during the break, we will do that. 615-737+. We'll get you lined up and ready to go. Stay with us.